Hi, you're watching Hindustan Times and I'm Aditi Prasad. As the second wave continues to hammer India, warnings have repeatedly been belted out about a possible imminent third wave. Many experts have warned that children could be more affected in the third wave. Taking that into account, even the Supreme Court has asked the government to put out a preparedness plan for vaccination of children. Till now, remember, vaccines are only approved for people above the 18 years of age. Now, joining me today is pediatric pulmonologist Dr. Dhiren Gupta, who practices at Sir Ganga Ram Hospital. Dr. Gupta, thank you for joining us here today. There are a lot of questions about the children's health and how they've been affected in this second wave and what might happen during the third wave. Let me ask you the most common question that is being asked by all anxious parents, that whether all this talk about this conversation about the imminent third wave affecting children more, how much is it correct? Is it right to say that?
Uh, mm, Sorry, I forgot your name.
Aditi.
Yeah, Aditi.
Aditi.
Yeah, Aditi. Let me very frank. Our scientists fail to predict this wave. So even if they are predicting a third wave, I feel that means it's all speculation. I mean, I don't think that Indian scientists actually means most of time are not correct. Means whatever they predict doesn't happen, and whatever happens doesn't get predicted. What I have seen means look at this wave. Nobody predicted this wave. So how can they
Mm,
can predict a third wave?
mm,
But leave aside that, I am interested in we should get ourselves prepared at any cost. Whether it's a third wave, whether it's a fourth wave, we don't want to repeat the same mistake which happened this time. One, whether it is going to affect pediatric, whether it is going to affect adult, we should be prepared. We should prepare ourselves that management protocols and everything is almost same, whether it's adult, whether it's a pediatric.
right.
Unfortunately, for pediatric patients, normally if I get a pediatric patient, we don't get bed. If our beds are fulfilled by adult patients, that is a major problem. Good point till now is that pediatric patient usually doesn't have that kind of illness what an adult patient have. So if one adult out of 100 requires hospitalization or intensive care, only one out of say 1,000 of pediatric patient require this type of care. So that is a fortunate part. But what is being predicted, even if it is that is not in scientific, there is no scientific basis behind it, but still I'm always believe in that we should prepare for the third wave. We should improve our healthcare structure. Lot of mistakes have been done, committed by politicians in this wave. Next time we should not repeat it. Next 6 months we should spend on infrastructure, whether it's adult, whether it's a pediatric, whether it's going to be severe pediatrics. What we require oxygen facilities, we require ventilators, we require enough doctors who are trained to treat these patients, and the places where we can keep these patients, whether it's adult, whether it's pediatric, you require almost similar sort of you can say resources.
True, true. So far, but sir, what's the impact of COVID in children in the second wave? How much have they been impacted? You've given
Yeah.
a sense, some sense of the numbers in your answer below before. You said that if it's 1 in every 100 adults, then it's 1 in every 1,000 children. Uh, is that a fair assessment right now? And what is
Yeah.
the
So
percentage of?
yeah, I think if I compare the statistics from the first wave to the present wave, first wave, younger people less than 40 hardly had this problem, hardly had pneumonia due to COVID. Fine.
Mm,
Regarding pediatric, it used to be like asymptomatic in almost 90% of the patients. Only just 10% used to be symptomatic. Also, that used to be some simple cold, cough, fever, nothing more than that. If I compare with the last wave, in pediatric this time, we had lot of problems regarding high grade fever. That was the number one complaint. That was of concern so much that parents usually require counseling for their pediatric patients. Second,
right.
diarrhea was another major complaint. And in some of the selected patients, this time definitely these patients require hospitalization because of pneumonia and because of one of the rare complications during acute COVID, that is MISC, that is multi-organ inflammatory syndrome. So it's very difficult to quantify, but I could say almost 30% rise as compared to the last year. So that is the basis of speculation, because this virus is continuously mutating and now it is affecting the younger population. And
Hmm.
bad part is that patients without comorbidities, without obesity, without hypertension, without diabetes, without any renal failure, they are landing in major pneumonia part. So that is of concern. So that is the basis of speculation. As we are vaccinating old people, as this virus is mutating, it is affecting the younger people. Probably that is the basis of that speculation.
Okay. You lead the COVID pediatric ward is at Sir Ganga Ram Hospital, sir. What's the situation like there? I mean, I'm sure it's not easy seeing little children suffer from COVID-19, but how have you been able to manage that ward so far? Is it the same as the adult ward where you're unable to admit patients because there are too many of them? How does it work?
Yeah. What is happening? We have got a pediatric ward, almost 50 patients, 50 beds are under us. But that is not exclusively for the pediatric, because adult means we cannot keep those bed vacant, because adult life is equal whether it's a pediatric or whether it's an adult ward. So
Right.
almost say 90% of these beds get filled up with the adult patients. So we are managing adult as well as pediatric. Last year also we have managed adult, and online also I am managing lot of adult, and just 10% are pediatric patient which actually require management. Now, having said that, what problem we are facing, that when pediatric patient requires bed, because most of the bed get acquired by adult patients, so we don't get space for them. So it is the same situation for the adult which we are facing for the pediatric patient. As I told you that if next wave is going to affect the pediatric patients exclusively, along it cannot be exclusive, it will affect adult also. So we'll have to have reserve the place for pediatric patients, because unfortunately this time it is not that serious in pediatric as compared to adult. Having said that, one more point I want to emphasize. Let's take an example of a patient who is 2 year, had 106 fever, and has some sort of seizure the patient had. Now, there was no bed for that baby, and that was in emergency. So we kept this baby in a temporary place. And the problem in the pediatric patient is who is going to take care of this patient. If mother is especially negative, if no attendant is available, you cannot manage a 2 year old, less than 5 year old alone in the ward. So that is another problem with the pediatric patient. So what we require for the pediatric patient, a designated ward where that is exclusively meant for the pediatric. Fortunately, we have got very good pediatric nurses. So mother has to take care of these pediatric patients. Despite that they are negative, they have to wear, they have to don the PPE 24 into 7, and at times 7 days. And good point of our, you can say, Indian moms are, they sacrifice everything. They never had any
Yeah.
thought process that they can acquire some infection. They sacrifice everything for their babies. But as we have predicted, next wave is going to be the pediatric wave. Probably we have to, prepare ourselves exclusively for the pediatric patients.
Right. Exclusively for the pediatric patients, we need to prepare ourselves. But a lot of questions, sir, around the symptoms, in children. What common COVID symptoms should we be looking out for in children? And when I'm saying for common symptoms, I'm talking about mild cases.
Yeah. As I told you, 99% of the patients are mild, and they usually have the same symptom as what an adult behaves. The difference is that symptoms at times are very subtle, like simple loose motions. It can be a COVID patient. Problem is that we don't recognize, parents also do not recognize these symptoms, and they hand over these babies to the elderlies like grandmoms, grandpas, and then these patients, because we don't suspect clinically, they become super spreader. Fine. Secondly, because now there was no lockdown 2 weeks back, so at times babies, or especially in kids like more than 4 years, they used to acquire infection primarily as an index case in a house. Then they used to develop, then they used to spread this infection to the whole family. That didn't happen last year. So what I want to say, the common features are like loose motion, simple loose motion patient can present, low grade fever, cold cough, and at times it is very high grade fever in some of the pediatric patients. And very uncommon symptom is they land up in respiratory problem. So they land up in low oxygen saturation, or fast respiratory rate, or blood pressure becomes low, we call it shock. So critical COVID patients in pediatrics still number is less. Mainly it belong to the mild. Mild patient can present with any with any clinical sign and symptom. Common is cold cough, low grade fever. Other is diarrhea. At times, babies present with just rash.
And these can be treated at home if it's a mild case, instead of rushing to a hospital. Like, see your local doctor and treat the child at home. Is that what you would advise, rather than rush to a hospital?
99% we can manage. Like 90% of adult we can manage at home. Same way in pediatric patients. What you require, you need to know red flag sign. If fever is persisting, especially more than 102 beyond day 5, or if baby is not feeding well despite he is afebrile, or there is a major rash which has appeared on the abdomen, on the face, especially eyes become suffused, or severe pain in abdomen. These are the some clinical sign and symptom which indicates probably some complication is happening in the baby.
Hmm. Okay, fair enough. So that's the time when you need to go to a hospital to then try and treat your patient, your child at home. And
Exactly.
so, the number of COVID cases in India, of course, is presently low, like it's been low in rest of the world also. But over the last 1 year, like let's say 1 year ago, child COVID-19 cases made up of only 3% of the total corona cases in the United States. But the latest report by the American Academy of Pediatrics shows that children represent 22.4% of the new cases reported in the last 1 week. What, according to you, is because normally we were told that children have better immunity, so they can fight off this virus better. Are the new strains, more virulent, which is why children are not able to fight them back anymore?
Yeah. That is very true. Means we have also seen, say, around 5 times, fivefold the pediatric patient getting affected. One. Second, it's almost say similar looking data. We Indians always lack in data and rely on the West, but that's true. One second part, why this is being happening in pediatric patients, very likely the new virus is mutated itself, that is affecting the young adult as well as pediatric age group. And not only it is become more infectious. Past last year, if say
Hmm.
2 members out of 6 members in a family used to get acute COVID, this time almost 100% of the members are getting acute COVID, so nobody is
Right.
getting spared. So it's become more infectious. One. Second part, the disease severity has definitely has gone up. So again, that's probably the reason for speculation for the third wave. Primarily getting means this pediatric age group may get affected. So that's why the reason that we should prepare ourselves for the pediatric age group.
Okay, fair enough. I want to ask you about the severe symptoms. You told us about the common mild symptoms to look out for. Sorry, common symptoms to look out for patients, COVID, child COVID patients. What about the severe symptoms, or the moderate or severe symptoms of COVID-19 in children? What are those?
Yeah. So we need to divide here these patients into two groups. One is that during acute COVID, like whole family is suffering from acute COVID, baby is also RT-PCR positive. Many of the patients do develop hyperthermia. Hyperthermia means high grade fever, more than 104, 105. Second is that they land up in respiratory problem like pneumonia. Their oxygen level goes down. They become tachypneic. We call it fast breathing. They become lethargic. They become septicemic, and you require to admit them. Another problem which is seen in, we call it MISC, multi-organ inflammatory syndrome. Most of time they develop after 2 to 6 weeks. So parents should be warned about this symptom. If somebody has suffered from acute COVID or a family has suffered from acute COVID, even if your child had mild COVID or asymptomatic COVID, just watch for another 4 to 6 weeks for this development, that is multi-organ inflammatory syndrome. But
Hmm.
10% of MISC do develop during acute COVID also. So what are the clinical signs and symptoms of this acute
Yeah,
COVID?
I was just
That
going
is
to say,
pain.
what is MISC?
Yeah, it is a multi-organ inflammatory syndrome. There is a body inflammation, and body produces too many cytokines and leads to lot of inflammation. It is in a hyper-inflammatory state. Fine. This can present in rare cases during acute COVID or after 2 to 6 weeks. Clinical signs and symptoms are same. Patient may develop severe pain in abdomen, blood pressure may drop, patient become too lethargic, eyes may become red, or skin become a little bit, erythroderma, red
Hmm.
looking, angry looking skin with lot of rashes. So these are the classical signs and symptoms of these babies. Then they should definitely go to an emergency, even if they are not able to reach out to the pediatrician.
Fair enough. But you're saying that 90% of the cases can be treated at home. Do not worry, do not panic. Try and treat your issues at home. But there is one big concern which people have, and which is about the vaccine not being available for children right now. Now, the vaccine not being available for children, so you buy your, in fact, the vaccine is not even available for people above the age of 18, frankly, because you try and register and buy one of those. You try and register on the COVID app, and you're just not getting because vaccines are not available. So, what precautions should children take? A and B. How soon do you think that the vaccine for children will become available? It is available, but in some parts of the world. But in India, there is still no approval for a vaccine for people below 18 years of age. So let first talk about the precautions, and then we'll come to the vaccine. What are the precautions that children should be taking?
See what happens. Say less than 2 years, we cannot mask them. They cannot use mask, and they won't use mask. Mask is dangerous less than 2 years because they cannot take it away once they feel hypoxic. So mask should not be applied in less than 2 years. So we have got limitations. One. Secondly, even 2 to 6 years, their understanding is not that good that you ask them to apply mask and they are going to apply. So that is a limitation in pediatric age group. They are going to be super spreader if they get infection. Means it's very
Hmm.
difficult to isolate them in room. And I have around many patients where the parents are suffering and they are asking the baby to get isolated in a room, and you know how naughty they are. Means it's
Right.
impossible to contain them in a home. We are talking about in a room. Fine. So, and there's emotional angle with the grandparent that they forget their susceptibility to the infection and they take care of their grandson and granddaughter. So that is an Indian, you can say, culture. So these are the pediatric babies, even if they are less victim of the severe disease, but they are going to be severe spreaders. So you can say super
Okay.
spreader. So we need to take care of them. One, how we can take care of them? One is that less than 5 years is not going to get infection from the outside. You are going to give the infection to the babies. So if you protect yourself, if you vaccinate yourself, if you protect, if you use protective, you can say mask and lot of things, then of course your babies are going to get protected
Right.
indirectly. Now we come to the adolescent. Definitely, adolescent means more than 10 year or 8 to 10 year, say a child, 6 to 10 year age group of the child.
Hmm.
Definitely, schools are not open, so we don't have that problem. But once schools are open, then we have to take extra precautions. Once they develop cold and cough, they need to be isolated, especially from the elderlies. Elderlies means more than 40, 45 year old. They should be you definitely kept in a single room. One, as early as we isolate them, less chances that it will spread to the home, and especially elderly should be prevented.
Okay.
Mask. Only that is the only preventive thing. Many people think that okay, can we improve the immunity? So I'm coming to that. First of all, physical distancing. We know that this is now airborne spread. Now, everybody has accepted this is an airborne spread. Even 2 meter distance is not sufficient, especially in a closed room. Only one thing which can prevent us, that is mask, and also that should be triple layered mask, not a stylish mask only one layer, and that will fail.
Okay, you're
Triple
talking
layer
about a
mask,
triple layer mask. Till
triple
now,
layer
there was
mask
the
means,
double layer mask. Yeah.
so it should be triple layer mask, and otherwise even a triple layer mask, if it is not N95, efficacy is 60 to 70%, fine. If it is a single layer mask, God knows what is the efficacy. With the present virus, the infectiousness of the present virus is almost 3 to 10 times much higher than the previous one. We need to have a proper mask, whether it's adolescent, whether it's a child, and adult, especially in the family, should don a mask. That is the main protection of the family. If I am unprotected, my family is unprotected. If my, like, look at your what are the chances that I get an infection as a doctor from hospital? Very less. Very likely I will get an infection from my near and dear, people who are working with me, residents who are in close contact with me, helping hands, helpers who are coming to my home. There are they come to you at a vulnerable time. I'm sitting at home. If somebody enters my home and I am not properly masked, it's so impossible to have a mask 24 hours into 7. Fine. This is my vulnerable time. Not when I'm in COVID ward. When I'm in COVID ward, I have proper PPE. Same thing is applicable to general population. Fine. So you are a journalist. Fine. What is your vulnerable period? When you're working in field, when you have to
Yeah.
speak out, you have to you have to doff your mask. That is your vulnerable period. And recently we have lost one journalist. That is, they are paying the price for their job. So
And
all people have vulnerable time, and that time this virus strikes. So when we are in offices, when our kids are in school, when people from a community visit you, that is the most vulnerable time, and 90% of the time people doesn't acquire infection from strangers. People acquire infection from the first close relatives. They may be your friend, but your virus is not your friend who is residing in 30 to 40% of the patients who are asymptomatic. That we should understand. If we want to save, not an immunity is going to save. Immunity may save you from acquiring a disease, severe disease, but not acquiring an infection. Once you acquire an infection, you become contagion for your family. Once you become contagion, you are dangerous as any stranger for all the people who are residing in that family. That is the basis of protection.
great, sir. I think that's very valuable information for our viewers. There's a question which is another question. Soma Singh is asking, at the rate of Soma Singh. She's watching our broadcast and she's asking this question. She's saying, my daughter is 7 months old, and because of my job, I go out. I take all precautions. What else should I do to protect her? And she has another part of the question, but I will come to that later. I'll ask you that later. Yes, please.
Yeah. See what is happened. What has happened? Past 1.5 years, people have wasted. Government has wasted its resources in hand washing, in washing mopping out with very expensive, you can say, sterilizers, and using very funny sterilizers and vaporizers and all sort. I've seen people getting paranoid when you're buying vegetable. You are paranoid. You keep them in a sterilizer. You open up a UV ray sterilizer, then you
Right.
boil them, and then blah 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 blah. And what they forget, while interacting with your vendors, while interacting with your people, you forget to wear mask properly. People wear mask keeping in the chin, and they are not donning the mask properly. Only mask. At today
Okay.
date, you can forget the maybe social distancing, but don't forget to wear an appropriate mask if you're going to office, you're coming back, means your clothes are not that not harboring that dangerous virus which you can spread to your baby. But if you are not donning the mask during your office time, you may acquire infection from your close group and from close friend or a colleague at office. Then you can transmit to your baby. So don't
Okay.
forget to don a mask during office time. If you want to have a lunch during office time, be alone, then consume the lunch. And no lunch, nothing should be shared, especially when you are not protected. Don't share anything with your colleague. That is the basis of the protection, and only then you can save your baby. See, I worked in COVID ward for almost 1 year. My duty is going to be there next Monday. I never had, I was never paranoid about changing clothes, keeping my shoes outside, and then getting, getting a wash and then going to my room. Never. It is the only mask that prevented, that is a protective thing. So if you are able to take care, don't divert. When we become too much paranoid for 2 3 things, then you get diverted,
Mm.
you get tired up very easily, and very soon you tend to lose your, you can say, appropriate COVID behavior. So
Fair enough.
first and foremost, and even the last COVID behavior is a mask. Don't forget that. Don't try to be paranoid about washing the hands, especially sterilizing the structures, sterilizing, mopping your floors, and too many things, and using UV rays. What we need in the finally, what I can say, that if you use mask appropriately, 90% you will be protective.
Okay. And she also asks that as a lactating mother, can she take the vaccine?
Yeah. See, vaccine is going to be the future. We started with the vaccination, you can say, planning with very enthusiasm, and now people are thinking that despite of vaccination, people are getting a lot of infections, and
Mm.
should we take a vaccine? Should we bear the side effect of the vaccine? What about the young people? They get clot? Means especially the Covishield. What is my experience is that vaccination has definitely prevented severe ailment, despite of, say, it has failed to prevent mild to moderate. It was never meant for mild to moderate infection. We have seen closely the benefit of the vaccination, and as soon as possible get yourself vaccinated. Say next 1 week, 2 week, this pandemic is going to settle down. Once it is safe to move out, to move to the vaccine center, then go to this vaccine center, get yourself vaccinated. Try not to acquire infection at this vaccination center, because these vaccination centers, most of the centers are actually become super spreader. People and government doesn't understand that. And if you look at 90% of the vaccine centers, there's overcrowding. What is happening? People are getting actual viral infection within incubation period after they got a jab, and people
Mm.
get confused whether it's a side effect of the vaccine or whether they have acquired actual viral infection. So
Mm.
most of time they are acquiring viral infection from this vaccine center. So go to these vaccine center when there's a minimum crowding, and try to avoid getting infection from the center. Have an proper behavior, COVID related behavior, when you are visiting these centers.
All right, fair enough. And my last question to you, sir, and I think I've already taken ample time from you, is about the COVID vaccine for children. Some countries have already approved uh, children taking the vaccine, and given the fact that you're saying that the third wave may be more virulent for children and may put more children at risk, how soon do you think we're going to allow? I'm sure you're not the government, but what would be your advice to the government for allowing vaccines for children?
Yeah. Um, the way the babies are super spreaders, can become super spreaders. And very good point about pediatric patients. Their tolerability for the vaccine is wonderful. If one patient out of, say, 100 get a side effect of vaccine in adult, just out of say, it's an assumption, 1 out of 1,000 will get a side effect in pediatric age group. So their tolerability is wonderful, especially less than 10 years. So definitely our program should be directed towards them as a priority. There are two
Okay.
types of patients. One is two types of human being. One is the victim of the disease. Second is the spreader of the disease. Previously, we used to say more than 50 years are the victim, and younger people who move out and from the house and for the work, they are the spreader. Now, that's not true. Any patient who is any human more than 25-year-old is now actually also the victim. There is no exception to that. Now comes the pediatric. Till date, we are saying that okay, pediatric patients are not that sufferer, but they are going to be spreader, especially in infants and less than 5 years. They are super spreader. Once they get infected, they will infect not only that house but community around them. Now,
True.
we need to target, our priority should be these subgroup of the patients, not only just adult who are more than 18. Once the vaccine safety profile is established in these pediatric patients, that is very easy to do. As I told you, the side effects of the vaccine as a general statement is pretty less in pediatric age group, and we should start vaccinating these pediatric patients as soon as possible. Good point about pediatric vaccination is that they have got very good established systems. They have got their pediatricians, and normally they go to the pediatricians and get themselves jabs of various other diseases. So the system for pediatric patient is well established. So I think they should be vaccinated as soon as possible. It's just the availability of vaccine is required. Otherwise, system is well placed for pediatric patients.
System is well placed for pediatric patients to get vaccinated. We need more vaccines. The government needs to sort out its supply side hiccups as far as the vaccine is concerned, and allow it for the younger age group at the earliest. That's the message coming in from Dr. Dhiren Gupta, who is a senior pulmonologist and pediatrician at Sir Ganga Ram Hospital in New Delhi. Thank you so much, sir, for joining us, and I hope this session
Thank you,
was
Aditi.
useful for our viewers, especially mothers, parents who are worried about their children and about what the third wave might entail for the younger population in this country. Thank you so much for joining us.
Thank you. Thank you, Aditi.